Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Reiter, and Dr. Gladden, for those that are on YouTube or checking this out on maybe an Instagram reel or Facebook reel, we are both in green like it's St. Patrick's Day. What the heck?
I know. That's what I said when Leo mentioned that. It's like, well, it's St. Patty's Day, except it's about 3 weeks late. So anyway, all good.
How you been, my man?
Good. Busy? Yeah, busy.
Yeah. What's the latest?
Lots of progress on many fronts. So yeah, really, really super interesting stuff going on. I mean, we could do a whole podcast on what's new, but we've got some really, really cool things in the whole regenerative space and rejuvenation space. Protocols to actually rejuvenate people, which I think is absolutely key if you're going to live young for a lifetime. Yeah. And then some nice breakthroughs on the whole cancer space also. Cancer therapy space. So really, really interesting stuff. Yeah. So if people want to know more, just reach out to us at GladdenLongevity.com and say you want to either know about cancer therapy or you want to know about rejuvenation protocols. We can set up a call with you and kind of understand, your situation and then make the appropriate recommendation for you. So, but yeah, some really, really cool stuff.
Now, I remember when I was co-hosting with the interviews, us having a company that was working in that cancer space and you were partnering with them. I don't remember the name, but is the cancer stuff related with that company?
It's in addition to that company.
Okay.
It's in addition to that company. Yeah. So, there's several companies that we partner with, and there's new diagnostic testing coming out around cancer. So, if people are wondering, hey, do I have cancer? I have a family history of cancer. I'm worried about cancer. And we're going to talk a little bit about skin cancer here in a minute. If you're wondering, do I have a genetic predisposition for cancer? We can answer that very, very readily. If you're asking, do I have cancer, that even though I don't have clinical cancer, do I have malignant cells? We can answer that question by screening you to see if you do have circulating tumor cells. But a new test that we just got a hold of enables us to actually see if the immune system has configured itself in a way that it's reacting to cancer cells, even if we don't see a circulating tumor cell. So when you think about cancer, the problem with cancer is it's always diagnosed at stage 3, stage 4, whatever it is, right?
Yeah.
And so it's too late by then. And so if you can pick things up when it's stage 0, 00, 000, right now it's like, oh, okay, I've got a genetic.
There's a 00 and 000?
Well, in my book there is, because if you can pick up the fact that your immune system is reacting to malignant cells, before you can even see what the malignant cells are, all of a sudden you can go on high alert and start to do some things to modify your immune system function and other things that will actually help take care of the cancer. And ultimately in cancer therapy, it's really the immune system that has to win the day, right? We spend so much time focusing on killing cancer cells. And in traditional medicine, they're killing cancer cells and killing the immune system at the same time, right? Radiation, chemotherapy, not so much surgery per se. But that's local removal when we know it's actually a systemic disease. So that's like it's like you got mold throughout your house and you're going to remove the chimney. It's like, okay, well, it didn't actually fix the whole thing. It's just there happened to be more mold in the chimney. So with these new approaches to being able to diagnose, we can see if there's mold in the house before you can even, detect mold itself, right? So like early mold. So if you get it at these early stages, then you can do some things to really kind of boost your immune system. You can also go in higher surveillance. You can double check your genetics and make sure that, what is this more likely to be and things like that. Then you can change lifestyle issues and et cetera. But there are also different supplements and different things you can do that can make it difficult for cancer. And so, if you start this process before you've got stage 3 or stage 4, it can make a massive difference in what's going on. And so we're excited about that. So, yeah.
All right. That's awesome news. So this month, May, is Skin Cancer Prevention Awareness Month. It's Osteoporosis Awareness Month, and it is Mental Health Awareness Month. So let's start with that first one, Skin Cancer Prevention and Awareness Month, because for those of us that live in colder climates, we're spending a whole heck of a lot more time outside than we were during the winter months. And so for those of us that are in these colder climates, what kinds of things do we need to be thinking about when it comes to skin cancer prevention and awareness?
Right. So the first thing I think is to actually understand what's your genetic risk for serious skin cancer like melanoma, right? And so there's a panel that can look at that, a genetics panel. It's done by Intellex DNA. And with that, you can actually get an idea of, do you have an increased risk for melanoma? They're looking at about 8 or 9 SNPs to give you an idea of that. But that can be super helpful. If you have those SNPs, then there are specific things that you can do to, decrease the likelihood that those SNPs will actually dictate the formation of cancer, if you will. So, you're probably going to wonder, well, what could you possibly do? Well, there's things, like having adequate vitamin D levels is super important. Having polyphenols in your system, like sulforaphane from broccoli and fisetin and genistein and curcumin, they all have anti-cancer properties. And then EGCG from tea. And the one that we like the most is Polypodium leukotomus.
That's a mouthful.
Polypodium leukotomus comes from a fern plant. We did an entire podcast on this a while ago. If you want to look up a podcast that we did on HelioCare, maybe a few years ago now. A great podcast, actually. And what this molecule does is it provides an SPF, right? So of about 5, which doesn't sound like much. It's like most skin creams that you would put on for suntan oil or lotions, not oil, but lotions or creams and things would have an SPF of, 30, 40, 50, 60. So 5 doesn't sound like much, but 5 actually, I've had people take it that burn easily, and just with 5, they actually don't burn. Now, it's more than just an SPF of 5. The other real thing about it is that it decreases damage at the skin level. And so we've seen people with, it was originally approved in Europe for treating basal cell carcinoma and squamous cell carcinoma, 2 very common forms of carcinoma, skin carcinoma or skin cancer, that all skin cancers are potentiated by excess radiation from the sun, UV radiation in particular. So when you take this molecule and go out in the sun, you're actually protecting your skin. Not only with the SPF of 5, but you're also protecting it from the damage that would lead to the cancer formation. And we've gone so far as to actually give this to people that have active skin cancer.
Yeah.
Polypodium leukotomus, called HelioCare, HelioCare. We have it at the Gladden Longevity Supplement Shop. And when you take it, we've seen that people with active cancer, the cancer will actually dry up and go away. Which is pretty remarkable, because there's a lot of people going to the dermatologist getting stuff cut off all the time. And so this is a really nice adjunct to seeing your dermatologist. You don't want to stop seeing your dermatologist. That's not what we're saying. And if you have something that needs to be removed because it's, likely to cause big problems, follow through with those instructions. But this can be super helpful. I have a close friend who is very prone to skin cancers. I saw him a couple of years ago. He had all kinds of bandages on his face. And, you've seen people like this, right?
Yes.
And he was a skier. He lives in Colorado. And he had a lesion on his leg, except his ski boot was kind of starting to bump into it where it was located at the top of his ski boot. But he didn't want to have surgery done until the ski season was over. So we started him on Polypodium leukotomus. By the time ski season ended and went in to see it, the thing had dried up and fallen off. They didn't have to do surgery, right? So it's really quite a remarkable product. So Polypodium leukotomus, under the name of HelioCare, I think is fantastic. And I think knowing your genetics can be important. taking the HelioCare, of course, wearing a visor. I go outside a lot, but I tend to go out not in the middle of the day. I tend to go out earlier in the morning or later in the evening when the angle of the sun is lower. So wearing some skin protection, longer sleeves, or even sunscreen, things like that. And then you can increase the pigment in your skin with a peptide called melanotan 2, which will actually activate your melanocytes to make more pigment. So you actually get a tan. And if you use that going into the sun, you tan like 6 times faster than you normally would. So even people that are very fair skinned, sandy haired, freckles, fair skin, red hair, and they burn, if they're out for 15 minutes, they get a burn, right? Using these kinds of products, you can really avoid burning, which is the first big insult that potentiates cancer and also aging of the skin. So those are some tips on skin cancer. That's what I do. So I take HelioCare every morning because I'm outside almost every day.
Nearly every day you are.
If I'm going to be out for longer than a few hours, I'll take another one at noon. I could take it twice a day.
Really?
Yeah. Mm-hmm. Yeah. And sometimes if it's a particularly sunny day and I'm going to go out and let's say I'm going to be surfing or I'm going to do something like that, I'll take 2. So you can kind of dial it in to make it to where you're really pretty well covered and protected. So yeah, we would recommend that a lot.
Well, for listeners that are interested in HelioCare, they can go to GladdenLongevityShop.com. And if you use the code podcast10, you'll be able to get 10% off your order. And I noticed, Dr. Gladden, at the shop, you're listing HelioCare for $29.99, and on Amazon, it's $30.99. So you already have $1 savings. And so if listeners stack on that podcast 10 code, they'll get even more savings on HelioCare, which is a supplement I'm definitely going to be loading up on this summer as I'm out hiking, especially above tree line.
Exactly.
Knocking out those 13ers and 14ers.
At high elevation, you have more radiation damage from the sun, less atmosphere to absorb the radiation, right? So in Colorado, it's particularly hard on the skin, or the Rocky Mountains or the Alps or wherever you live, right? So, yeah.
Mm-hmm. Well, one of the articles regarding skin cancer that our producer Leo sent was one by ZME Science, and title is "The UK is trialing a custom-made vaccine against skin cancer." And basically, from what I've read, it's using an mRNA vaccine to try and help to reduce the recurrence of skin cancer in patients that have been treated. And in the phase 2 study, they found a 49% reduction in the risk of recurrence or death after 3 years compared to the standard treatment.
Yeah. I mean, messenger RNA vaccines are pretty controversial, for one thing. The second thing is it's possible to make vaccines to many types of cancer, quite honestly. If you have the actual cells from the cancer itself, you can actually create vaccines to them. The reason it's working part-time and not the rest of the time is that cancer is kind of the ultimate survivor. It's almost like life itself. Like, what would it take to exterminate life on planet Earth, right? Think about what would it take to actually completely sterilize the planet? Pretty much the sun has to turn into a red giant and gobble up the Earth before that probably happens, or the Earth has to lose its atmosphere entirely as the sun is enlarging in order for that to happen. Something catastrophic like that. And so with cancer, a vaccine that, or even a treatment, or even a custom treatment to a cancer struggles to win the day because the cancer continues to mutate and change and evolve, if you will, around the therapy. And this is where ultimately for cancer to be defeated, the immune system has to come in, and boosting the immune system has to play a critical role in that. So anyway, that's what I'll say about that. So yes, I think those vaccines are interesting. I think taking the HelioCare, which we've seen amazing success with, is a whole lot cheaper and easier, and it's available today. So that's what we're wearing good quality sunscreen that doesn't have a lot of toxins in it. So.
I noticed on Amazon also that HelioCare does make a couple different sunscreens.
Yeah.
And so that could be something else that listeners could be
absolutely
add to their repertoire.
That's it.
So It's also Osteoporosis Awareness Month.
Yep.
Talk about osteoporosis, Dr. Gladden, and
Well, it's
what
a
you've seen.
massive problem. It's a massive problem for a number of reasons. One is that certain people are predisposed to it genetically. And again, the Intellex DNA has a really nice panel. You can't just buy these individual panels. We've talked about the melanoma panel and the osteoporosis panel, but if you buy a more comprehensive panel, it will include those. And different people tend to either have a difficulty in making new bone or they over reabsorb bone, right? So think about, bone is constantly remodeling. So you've got cells, osteoblasts, that are building bone, and you've got osteoclasts that are actually breaking down bone. It's the balance between those two, right? So, and at bone density, if you're making bone faster than you're breaking it down, your bones stay dense or get denser. If you're breaking it down faster than you can form it, then you're losing bone. And so you're developing osteopenia followed by osteoporosis. And that can be measured quite accurately with a DEXA scan that looks at bone density and gives you a score relative to people your age and relative to somebody in their late 20s. So you can compare to both. And the interesting thing is that in order to maintain bone density, it's important early in life to get enough vitamin D, everybody talks about calcium, but everybody gets enough calcium in their diet. That's not really the thing. Enough vitamin K2 is very important as well. MK7 works to put calcium into bones along with the vitamin D. And not everybody processes vitamin D efficiently either. And so there's thoughts that synthetic vitamin D is not as good as like cod liver oil or things like that, where you're getting more of natural vitamin D. Certainly sunshine can produce vitamin D, but if you're older, your skin doesn't make that conversion very efficiently. So you can't really rely on making vitamin D your entire life to effective standards. So taking a vitamin D supplement with K2, again, we carry that in the Gladden Longevity supplement shop, just simply because it's so foundational, not only for bone health, but cardiovascular health. And then the other thing is that weight-bearing exercise, right? Lifting heavier things, pushing up against immovable objects, doing isometric training, wearing weight vests, things like that, things that load the frame enable you to build bone. But what really is required, and those are required. What really is required is to have good hormonal levels. You've got to have testosterone. You've got to have estrogen. You've got to have growth hormone. And as we go through life, we stop releasing growth hormone. We don't stop making it, but we stop releasing it. And so using peptides that can release growth hormone like CJC 1295 with ipamorelin or things like tesamorelin, which are getting harder and harder to get in the U.S., but those can be very helpful. There's also a product called BioPro Plus, which we carry at the Gladden Longevity Supplement Shop, that actually has a lot of trophic factors in it. In other words, it's made from deer antler fuzz, and it turns out that fuzz has lots of very, very potent growth factors, like hundreds of them. And they, in conjunction with exercise, lifting, vitamin D, etc., K2, can actually help build bone also, and muscle for that matter. If you're building, the things that you would do to build bone are also the same things you do to build muscle. They kind of go hand in hand. And we know that losing muscle as people age is a big deal too. So the CJC will help build muscle. These things also really improve performance. Like if you're going to go, let's say you're going to go on a ski trip. Let's say you're 70 years old and you want to go on a ski trip. Well, if you're, or even 60 years old and you want to go on a ski trip, what you want to do is you want to make sure your testosterone levels are up. You want to make sure that your growth hormone levels are up. And the way you do that is to inject the CJC 1295 at bedtime. And then you can use things like BPC 157 along with it, which upregulates growth hormone receptors. So just think about this for a second. So let's say we're going to go skiing Saturday. So I'm going to inject testosterone on Friday. Friday night, I'm going to take CJC with ipamorelin and BPC to get the full growth hormone release and receptor activation. We'll go skiing on Saturday. I'll be snowboarding, but you can ski. And then at the end of the day, it'll have been a great day. We'll feel a little beat up because you and I are going to push ourselves. And so that night, I will re-inject the CJC 1295 with ipamorelin and re-inject the BPC 157. And Sunday morning, when we go ski, I will feel like we didn't even ski on Saturday. I will be completely rejuvenated. My muscles will feel great. Everything will feel great. Yes, really, truly. And if I add in the BioPro Plus just for kicks, that will help accelerate it as well. So we ski on Sunday. And I feel like I didn't ski at all on Saturday. Now we're going to ski on Monday. Now you're getting tired, but I inject again on Sunday night. On Monday, you have a hard time keeping up because I'm totally fresh, even though I'm chronologically years. Right, yeah, exactly. But I'm cheating, right? But the point is, you want to cheat. Why wouldn't you want to cheat? So this is how we prepare for bigger events, mountain bikes, or riding, or bigger whatever. And so when you're doing that kind of stuff, you're building bone density and muscle. And so that's the key takeaway. But you've got to have that hormone optimization there. Free testosterone levels need to be in a sweet spot. They don't have to be at the high end, but they need to at least be in the middle. Estrogen levels need to be there. They're very important for bone formation. And not everybody's estrogen receptors work well. So you can actually improve that with supplements as well. All of this is outlined in the Intellex DNA report on how to use the appropriate supplements to make all the genes around this work as well. So very, very interesting stuff. Yeah.
So I think anything else regarding osteoporosis that you want to talk about?
Well, I will say that when it comes to osteoporosis and osteopenia, the only people that we've ever seen really be able to build it significantly are the people that do a combination of exercises, kind of like the OsteoStrong exercises, coupled with optimizing the hormones. And then the supplements kick in too. But really, when you get that combination, you can see significant gains fairly quickly for people. Other than that, it's a bit of a tussle. It's a bit of a struggle. But when you combine that, the magic is in combining those things. That's when you really start to see gains. So I had my bone density test. I know everybody knows I'm 27, but I've completed 70 laps around the sun. And I did a bone density test a few months ago, and I was above average for somebody in their late 20s for bone density. Right. Wow. So it's like, yeah, exactly. So, and my mother had osteoporosis. So the point is, whatever your parents had doesn't mean that's what you've got to have. If you take care of yourself, if you understand what your genetics are, what cards you're holding, and you know how to play the hand, you can avoid all these things like skin cancer and osteoporosis. Yeah.
Well, Dr. Gladden, this is also Mental Health Awareness Month, which I think is probably of the three, I'd say the most universal, the most important, probably. Everyone has struggled in some way, shape, or form with mental health. For sure. And so one of the things that Leo wanted to find out, for me to find out from you, as well as for me to share, your journey when it comes to mental health. Yeah. I distinctly remember in my interview of you getting your full story, and I've heard you talk about it in other podcasts as well, struggling with depression before you really started to dig in and start to figure out, how do I live young for a lifetime?
Oh yeah, no, that's for sure. You're born, you grow up, you don't really know what your genes are around anything. You feel like, life was fun. I was a kid. I was out playing, having a good time. I wasn't depressed or particularly anxious as a kid. You go through high school. Yeah, you have some depressing things that happen in high school, like a breakup or losing a friend or somebody moves away or, whatever it is. And we all face those challenges. Or you don't do as well as you want to on a test and you're feeling, you're beating yourself up and you have anxiety about that and what's going to happen and things like that. And then, you go off to college and, depending on the college you go to and the major that you major in, you can be pretty inundated and overwhelmed at times with the amount of new stuff there is to learn and to acclimate to. And so then from there, you end up going to medical school and talk about a grind. I mean, it's basically from 8 in the morning till 11 at night every single day. And then the exams are always on a Monday, so you get the benefit of being able to study all weekend, right? So it's really a grind. And then you think after the first 2 years, well, that was pretty tough. And now you're taking call every third night. So now you're up most of the night every third night, and you're still trying to learn, and you're doing all this, right? And then you go into an internship where you're really, you're in the hot seat, and then a resident who's covering the hot seat, and then the fellow who's covering the resident who's covering the intern. And, it just becomes a really a deep grind. And then if you go through, I went through a divorce as I was going through my cardiology training. And I had my son had been born. He was 18 months old, and it was like, oh my gosh, I felt like the bottom of my life had fallen out because I'd never experienced unconditional love like I had when Chris was born. And so to go through that experience in the midst of all the other demands on my time and psychic energy, it threw me over a cliff. I became suicidal, quite honestly, and really deep. And so, therapy, counseling, some divine interventions at certain moments when I was really on the precipice, and a couple other things. And then I realized after I got through my 20s into my 30s and got out of all my training and actually started to feel like I was living a life again. Like, you didn't have to be up every night, and you had your weekends off, or at least some of the weekends off, or something like that. It was like, oh my gosh, it's like, I think I was depressed for an entire decade there, quite honestly.
Wow.
Right. And then it wasn't until later when in my 50s, I would come under stressful situations and feel myself go over a cliff of depression, just like you could talk yourself out of it, or go for a run and feel better, or talk to a friend and feel better. It was just like a cliff. That's when I got tested and was told, everything checks out for your age. You're just getting older. Why don't you take an antidepressant? And that's what threw me into, no, I'm going to unravel the knot here. And so I started doing genetic testing. And that's when I actually, for the first time, figured out, oh, gosh, genetically, I'm really predisposed to depression. And I'm really predisposed, not to anxiety, but to depression. And I'm really predisposed to cognitive decline. My dad died with dementia. And so I have genes that line up. I do not have the Alzheimer's genes, but I have genes that, if they're not treated effectively, can basically drive me down that road. So once I learned what those genes were and learned what supplements I needed to take to compensate for them, and got my thyroid fixed and got my hormones fixed, all of a sudden it was kind of like, wow, I feel good. Like, I feel really good. Like, I can come under a lot of stress and I don't, I can just deal with it, right? And then I learned to meditate, right? And then from there, it was like, oh, now I have a transcendent perspective on life here. And so I did some therapy. I did some deep dives with other people. Some of them were therapists, some of them were not therapists. But at the end of the day, optimizing mental health has been a lifelong journey for me. And to this day, it's really about how, this is part of the question of how good can you be, right? It's really how mentally replete, how spiritually replete, how relationally replete. How do you crack the code on those things? So I think it's at the center of health, right? Because I don't care how much bone density you have, or if you don't have skin cancer, if you kill yourself, who cared, right? So really,
or even, I think there's also the aspect of, if someone is depressed or if they are anxious, that stress is being put on their body and on their hormones and on their digestion and on their energy.
For sure.
It affects everything.
For sure. Yeah, there's no doubt that people age so much more quickly when they're under significant stress. And we can measure all that, right? We can measure it through several different lenses and see just how stressed is the system. And it is a massive accelerant in the aging process, for sure. Massive accelerant. So, yeah. How about you? What's your story?
When I was in high school, I started to really notice that I could get depressed and just get stuck in these ruts. And it would come up occasionally in college and adulthood. And it wasn't until 2012 when I left working for an internationally syndicated radio broadcast. I was just completely burned out. I was doing 2 daily broadcasts with half the staff I had at the previous job to do 1. So I was doing double the work. And even more, quadruple the work. And it was in coming out of that I really started to really dig deep into, biohacking and really advanced health stuff, and listening to these, biohacking podcasts.
Yeah.
And in that, I mean, I found some real keys for me in keeping things under control. One, getting morning sunlight.
Yeah.
I mean, that for me is super important, to just kind of rest, sit out on the back porch, or open the back patio door and just kind of sit there with the cool air in the winter kind of blowing on me, and just kind of getting that crisp, fresh air.
Yep.
Eating well.
Mm-hmm.
I mean, when I'm eating a lot of greens and a lot of various colors, as you like to say, I feel better.
Yeah.
Because I'm feeding my gut microbiome all these different things that just help me feel better. And exercise, whether it's especially outside. I mean, for me, getting outside on the trail, outside of the city limits, where I can barely hear a car, if I hear a car at all.
Right.
Usually the only thing I hear is just the sounds of nature, and maybe some jerk that's on the trail that's got a Bluetooth speaker playing that I just want to punch as he's passing me, which then brings my stress levels up a little bit.
Okay.
And then, honestly, microdosing has been a big help for me.
Okay. There's a lot of interesting data on psilocybin and depression that's come out. That's really interesting. What I would say is that, again, Intellex has a really nice mental health panel also of genetics for people that are wondering, right? And we do all these panels that people want to reach out to us at GladdenLongevity.com. We can see what you might benefit from. But it can be incredibly revealing in terms of how you're genetically wired, right? And you may know this about yourself. It's like, well, I know I'm prone to be anxious. I'm prone to be angry. I'm prone to be stoic. I'm prone to be whatever it is. But when you see the genetics and you see, oh, it's this gene and that gene and this gene, and if I do this, this, and this, it actually can compensate for those genes. And so you start taking these things based on what's in front of you. And it's like, you know what? I'm feeling better. I'm actually feeling better. And it's like, and then you add in the things that you're talking about: fresh air, sunshine, getting outside, meditating, being out exercising. All of a sudden it can come together in a really beautiful way where you don't need an antidepressant. You don't need an SSRI or anything else for that matter. So it's pretty cool.
One of the articles that Leo had sent us is from CBS News. Psychiatrist urges caution when turning to AI for mental health.
Interesting.
And so basically the psychiatrist, Dr. Brent Nelson, is saying it's just not ready yet for prime time.
Yeah. So the audience probably is aware of the impact AI is going to make in medicine. And we've been working with AI for 5 years, building up portions of the practice with it and many other things that we do. That being said, one of the targets for AI is for AI to be able to function like a therapist. And of course, an AI never needs to sleep. So an AI could be available 24/7. Right?
And a part of that is because there's actually a shortage of therapists, psychiatrists, psychologists,
physicians.
Exactly.
Any healthcare provider, there's a shortage, right? Any healthcare provider, there's a shortage. So when you think about it, if somebody had access to an AI that had been programmed in a way to be empathetic and thoughtful and a good listener, if you will, because I think a lot of mental health therapy boils down to really listening well. I think a lot of mental health professionals are trained to have particular answers. Like you see a psychiatrist, so we're going to start this drug. Which drug am I? You walk in, which drug am I going to start for this person? Right. But then you have psychologists and you have other people that do somatic therapy and other forms of therapy. And it's like, no, what's there's no pathology here. Who's the person inside here trying to get out, right? And how do we actually help them become their full expression and not be living in reaction to the traumas that they've experienced? So let's understand the traumas. And if you understand the traumas and the genetics, now all of a sudden it becomes incredibly powerful. And you can really, really make 90 degrees turns, even 360-degree turns, not 360, but 180-degree turns to where you're really going the other way. So Yeah, I think it's super important. I can't emphasize it enough. And it's something that, Mukti's been on the podcast. She's doing a master's out in Europa in Boulder in psychotherapy. And she's a yoga therapist also and some other things. But we garden in our relationship constantly gardening in this area of psycho-spiritual dynamics and understanding and things like that. And I think it's a really interesting place to go after, but you end up having so many realizations and insights that it leads to so much relational satisfaction, completeness, and growth, quite honestly. So finding somebody you can do this with. Yeah. It's not like you just go someplace and do it one time. Oh, now I'm good, right? They fixed my ankle, they fixed my knee, whatever. Now I'm good. Yeah. It's not like that with mental health. Mental health is an ongoing thing because there's always new stressors, right? New stressors, change is inevitable. That's the only thing that's guaranteed. And so how you manage all those things and understanding yourself and having a good support network of friends or a close confidant, critical for all that. Yeah.
Well, two of the other articles that our producer Leo had sent, one said parkour athletes say the sport boosts mental health. And I would assume that's in part because of the movement and in part because of being outside, jumping from, building to building sometimes.
It's dopamine, right? They're getting more dopamine. So doing cold plunges, like there's some really nice data on people that have addictive personalities. Let's not say they're addicts per se, but let's say they have addictive personalities. And maybe they've struggled with addiction. A lot of that's due to low dopamine signaling. And so in order to get a dopamine boost, they do some risky activity, like let's go gambling, let's go, rock climb and do it without ropes. And let's, things that are inherently sort of risky, if you will. And if you jump into a cold plunge, your dopamine goes way up, like hundreds of times, not hundreds of times, but it goes up multiple X's, right? So that you get a really nice dopamine hit out of that, and it can have a massive impact. So if you're struggling with addictive tendencies, or even depression, anxiety, et cetera, getting into a cold plunge first thing in the morning, maybe go work out, come back, jump in, stay in there for, initially you can only stay in there for 30 seconds because you haven't acclimated, then build your way up to where you can be in there for about 4 minutes, 5 minutes. It's a massive game changer for people. So.
Well, the other article that Leo had sent, bird watching can significantly improve students' mental health.
I wonder if that translates to girl watching or boy watching. I think, think about that for a minute. What is it about nature, right? I think there's a sense of being connected to the earth, being connected to the planet, being connected to ourselves, getting out of the hustle and bustle, getting away from cell phones and apps and things that are always competing for our attention. One thing that I've just saw recently was that the UK is now the second least happiest country in the world.
What?
Yeah, the UK. And it's not because of economic poverty, right? It's an economically, strong country, if you will. It's the fact that there's so much isolation. And the interesting thing is people have hundreds of Facebook or thousands of Facebook friends, and they don't have any real friends. Isn't that interesting? So we become much more isolated. I was listening to the Surgeon General talk about this in England, and he was talking about going onto a college campus, and when you'd go into the cafeteria, right, commissary, normally, like when we go in, it'd be just full of conversation, right? Everybody's talking and everything. Now, apparently, when you go in there, everybody's got an earbuds, looking at their phone and eating, and it's like super quiet. It's like going into the library, and nobody's having conversations. So in our technological world, we're actually reinforcing how not to have relationships with other human beings. Right. And now you're talking about AI being surrogate friends and surrogate lovers and surrogate this and surrogate that. It's like, oh my gosh, we're completely losing sight of who we are. And it's this idea of really having a strong friend network and all this kind of stuff becomes just critical to intentionally build. It's like, I'm going to set my phone down. I'm going to go talk to 5 people today and have a real conversation. This is so key for mental health.
I think not only that, but I think also, especially when we go back to us talking about stress aging us, we're approaching a time that comes up every 4 years where there's a lot of political news and the presidential election.
Sure.
And then also you stack on, what's going on in Ukraine, what's going on in, Israel and Gaza.
Yeah.
How important is it for us to just turn off the damn news?
Oh, it's so critical. It's so critical. I mean, there's nothing, quite honestly, that you can do, right? And there's no, everybody's, well, your vote matters, right? I get all that conversation. But the point is, there's nothing that you can do that's actually going to change that. Now, what I think is important, though, is to actually take control of what you can take control of. And so I think understanding that, and if you want the world to be a more magnanimous place, a more forgiving place, a more healed environment, a more friendly place, then be that person, right? Be that person. And I think there's great mental health benefit to being kind, to being nice, to going out of your way to help other people. One of the best ways you can feel good is to actually help somebody else. So really critical. Yeah.
It kind of goes to one of the things that I tell my boys all the time. There are only 2 things in this world that we can control. Yeah. Our actions and our reactions.
That's
how
it.
we react to people, how we react to events, how we react to all that.
Yep.
Our actions and our reactions.
That's it. No, and there's, that's wisdom right there, right? And it's easy to get caught up in all the hustle and bustle, everybody's opinion. And I think a lot of it, quite honestly, leads to binary thinking, where people get sucked into right, this is right and that's wrong. These people are right, those people are wrong. Whichever side of the fence you're on, it doesn't matter. It could be any fence, quite honestly. But it's the act of binary thinking that actually leads to, we're over here and they're over there. And as soon as we're not together, everything sort of breaks down, right? Now it's just, and you're not going to convince them. They're not going to convince you. So where does that leave you, right? It leaves you in some sort of a struggle. So really being able to come together with people around things that people can agree on, like it's good to be kind, right? It's good to be helpful. It's good to, help an old lady cross the street or carry a bag. I mean, all those, everybody can agree on many things that are good. Why don't we do more of those? So
of all the things that you're doing for your mental health, Dr. Gladden, what is your favorite?
Wow, man, that's a big question. Oh gosh, I do a lot. I do a lot of things for my mental health. I think, I don't know that I can. I really can't parse it out. This is part of the.
This kind of depends on your
fallacy.
mood.
This is the fallacy of reductionism.
Yeah.
That we can reduce it down to a single thing. Like, just tell me the 3 things I need to do. Well, it's kind of reductionist thinking, right? Because what's really important is to actually have an integrated, synthesized whole. So I can tell you the key components that are that. One is journaling every morning. One is meditating every morning. One is having really deep, gardening, courageous conversations with my partner about life and us and how things are happening. One is reaching out to family and friends on a regular basis to make contact. Another one is getting outside, getting sunshine, getting exercise, being in nature, and exercising in nature. I find it going into flow states with that. And I think those are probably some of the main ones for me. There are supplements that I take too that are super helpful. So I think that's another piece of it, right? So certain B vitamins, folinic acid. Everybody knows about methylfolate, but folinic acid is really important for my MTHFR1 gene. So, again, you can learn about your own genes at Intellex DNA. If you want us to test them and go over them with you, we can do that for you at GladdenLongevity.com. But it's so fascinating when you start to put the pieces of the puzzle together, and you actually get to start to take control over your own mental health rather than sitting there feeling like a victim. So
I was expecting, when I asked you that question, what's your favorite, for you to just say sex.
Well, There's no downside to oxytocin. What you're really referring to there is I know you're referring to sex in a way, but really what we're talking about is oxytocin.
It's connection.
Yeah, connection, feeling loved, being known, knowing and being known, loving and being loved, and having that really close connection, that sense of bonding. That's just so critical. Yeah, and we feel loved, and we feel worthy, and we feel embraced, right, for who we are. You can't beat that. Yeah.
Dr. Gladden, thank you for this Q&A episode. For listeners, if you are interested in sending us a question that you want answered in our June or July question and answer, be sure to email podcast@gladdenlongevity.com. That's podcast@gladdenlongevity.com. Or you can even go to gladdenlongevitypodcast.com and submit a question there. Dr. Gladden, enjoy the rest of your May.
Yeah, you too. All right, everybody go out there and build some bones, get some HelioCare, get your hormones optimized, and then learn really what the underpinnings are to your mental health. I would say doing some genetic testing, you'll be stunned at all the insights that you walk away from it with. It's really, really revealing, really helpful.
This episode of the Gladden Longevity Podcast is brought to you by the new Gladden Longevity Anti-Inflammatory Shroom Formula.
A little background. Our anti-inflammatory formula is a potent blend of adaptogenic mushrooms specifically designed to support your body's natural defense mechanisms to reduce inflammation. This unique formula contains a powerful mix of medicinal mushrooms, including agaricus, reishi, cordyceps, and maitake, known for their immune-boosting and anti-inflammatory properties. Together, they do a great job of turning down a major driver of inflammation.
I've been a big fan of adaptogenic mushrooms for a number of years now, and I was really excited to find you all were coming out with this. This is a superior product to what I've tested on the market.
Yeah, we love it, and our clients love it as well. Again, this is a tincture, so we will put it in tea, we'll put it in a smoothie, we'll put it in water and drink it. But to know that you're actually able to decrease NF-kappa beta, which is a major driver of inflammation in your body with this, it just goes along with everything else that we know about aging, that inflammation is the key driver of the aging process. So we love going straight at the heart of it with this formula.
Get 10% off your order of the new Gladden Longevity Anti-Inflammatory Shroom Formula when you use the code podcast10 at gladdenlongevitysshop.com. That's podcast10 at checkout when you visit gladdenlongevitysshop.com.
Experience the power of adaptogenic mushrooms with our anti-inflammatory formula and embrace a healthier, more balanced lifestyle.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.